those who are here today will enjoy every bit of it. When Shailaja came years ago, it's been 3 years, I think. 2.5. 2 years, 6 months, and maybe 3 days. And I presented her, gave me her idea, and I was at that time in Shivnad University. I found that idea very exciting because we always talk about unqualified medical practitioners and the things they do. But there's so little work on the subject, as she said. And I'm glad she pressed on, and she's eventually done a great job. And this book is in front of us. It's entitled Unqualified Medical Practitioners in India, the Legal, Medical and Social Dimensions of Determinants of Their Practice. This study is also loaded with a lot of field material, first-hand research material, over and above in-depth and close discussion of the various policies in the health sector that impact on this area. So anyone who reads this book will get a grounded picture of the entire scene, beginning from these practitioners, who they treat, and how should we look at them in the long run in terms of policy. So I think we should now hear Shailaja present the book, and after she does that, we can open up for the floor for discussions. I think I should prepare Mr. C.K. Mishra to get ready and clear his throat and so forth, because he'll be up very soon. I hope you don't mind. Shailaja? Much. I think we've had very fruitful discussions so far, and we're doing rather well. No one has gone to sleep. And I think that from now on, we should get ready to ask questions. But before you do that, I'd like to point out something which really worried me. You know, the Human Development Study, India Human Development Study, they bring out the reports from time to time. And they said that as far as facilities go, and this is what you also mentioned in terms of training, the allopathic doctor, the PhD doctor, is much better trained and has much better facilities than the unqualified medical practitioner. Yet about 70% of the sick in our country go to the unqualified medical practitioner and not to the better trained, better equipped PhCs. So obviously it's a question of doctor-patient relationship more than anything else. What is also very frightening is the frequent reference to the fact that these unqualified medical practitioners are as good as doctors. This is really frightening. What kind of training are we giving our doctors? If our doctors are as good as unqualified medical practitioners, there's something seriously wrong going out there. Instead of saying that they're as good and therefore let's get on with the job and be jolly about it, I think we should really sit down and ask ourselves something seriously wrong, because you cannot allow this to happen. One of the reasons why we seem to overlook it is because health is an organic thing, it's an open system. And therefore, no matter what you do, you'll always make some mistakes somewhere. It's a bit of hit and run, and so better doctor you are, you hit more than you miss. And that is why, you know, over a period of time, practice is so important in making a doctor perfect. And I think that we should pay attention to the fact that has to be a certain standard with delivery no matter what. And this has been mentioned by the panelists as well. Of course, you talked about Kenneth Arrow. This point was raised by George Rosen some time back when he said that there is asymmetry not just in the doctor's knowledge and that of the patient, but the asymmetry spreads much wider than that, asymmetry between doctor and doctor. Because as I mentioned earlier, the body being an open system, you can put all the doctors in the world together, bring them to this room, let them share the knowledge, and yet there'll be a huge remainder that nobody knows anything about. And it is this that I think allows for all kinds of nefarious practices to happen. And to curb that, we have to increase the level of services that a qualified medical practitioner delivers, instead of saying, so what? Everybody's the same, they're all equally good or bad, and let's not worry too much about it. In my view, the PhC should be the gatekeeper. And to have the PhC work effectively, you must have those who are qualified to recognize a serious illness from a non-serious one. In my view, nobody goes to a doctor unless that person is ready to adopt a sick role. If you're not ready to adopt a sick role, you'll go to your grandmother. But it's only when you adopt a sick role, you go to a doctor. So you must have a chain of command whereby everybody in that chain of command is qualified in one way or the other to deliver along the route. And that, I think, is one of the recommendations that Shailaja has made. And I think that if you look at Shailaja's recommendation in the round, these things all come together as one package. And as that package, when delivered, I think will do the best for our country. And we should never, ever stoop to believing that there should be one kind of health system for the rich and another one for the poor. We should resist that temptation, because in India, I think the temptation is great. And I've heard it also, I'm sorry to say, from the WHO. Now, you guys can't afford good medical care. Whatever you get, let's try and upgrade that a bit, spruce it up, get a little spit and polish, and get on with it. I don't think that kind of shortcut is a good idea. But that is my point of view. And as I'm in the chair,